morning for your review and convenience. Okay, with that, Dayna, if you would please take it from there.
Okay. Good morning, everyone. As Michael said, my name is Dayna McCrary, and I am the administrator for community partnerships for Franklin County, Ohio. I am so pleased to be with you this morning on behalf of the Board of Commissioners. The commissioners are very excited to be able to bring this opportunity to you in partnership with the City of Columbus. The Board of Commissioners has invested $5 million towards this resilience initiative, knowing that our nonprofit organizations really are the backbone and the safety net of our community. We are so grateful for the work that each one of your organizations does every single day to help keep roofs over people's heads, to help people to feed their children, and to just respond to need that none of us could have anticipated on February 1st. So I want to express my gratitude to all of you, especially on behalf of the Board of Commissioners. Encourage all of you to apply and to keep doing the hard work that you're doing on behalf of Columbus and Franklin County's most vulnerable residents. Thank you.
Thank you so much, Dayna, and we're so grateful for the county's leadership and the commissioner's leadership and yours, and your tremendous generosity in supporting this effort. Next, I'd like to ask Kim Stans to please speak and lead us through the really critical RFP.
Okay, great. Thanks, Michael, and thanks, Dayna and Melanie, for joining me on the panel. We're going to go through a presentation that will take us through the RFP that's been sent out to everyone. It'll look pretty much like what you're looking at. So if you have that in front of you, you can also have that as well to look at. Michael's going to bring that up in a minute, but before we do that, I really want to follow Dayna and just say that I am really thankful for lots of different things. And some of those main things are that we have a mayor and a city council and county commissioners who really see the human service sector, the health and human service sector, as key to our recovery, and that they were willing to make this kind of investment. We have known that there are needs, and in fact, the framework we're looking at is kind of what I would call a 4D framework of how we're looking at this. We saw problems. Those were brought up to us through Human Service Chamber and United Way surveys that said, look, people have revenue losses. There are increased expenses. What can we be doing, on behalf of the nonprofit sector? We saw that cause. We diagnosed that cause. We said, this is COVID. And so when the US Treasury said, here, through the CARES Act, here are monies that you can invest in your community related to COVID, we said, yes, this is something that we can do. So we defined the goal by saying we want to help the human service sector bounce back. It's basically helping the helpers. And so as we go through this webinar, through the RFP, you're going to see it's really about you. It's about the agencies. It's about the nonprofit organizations. That's what we're really focused on. Because we know it's you, it's going to be able to meet increasing demands and needs within our city and county. So the fourth D, so we detected a problem, we diagnosed a cause, defined a goal. So the option that we developed was, let's take CARES Act money. So the city said, well, let's take $15 million. And the county said, hey, we want to jump into this too. We're going to add 5 more. So we have $20 million to invest in nonprofit 501c3 organizations. So I'm just really thankful that the administration, my director, Mike Stevens, really saw this and said, let's invest in it. So we're seeing this as investment, a way of investing CARES Act dollars into our nonprofit sector. And then finally, I'm just thankful for all of you who've joined us and who will continue to join us over the next 2 weeks as we go through this application process together. I had a lot of friends who helped me put this together over the last 2 weeks. Dayna was one of those. Michael was one of those. Others that helped me were Hannah Jones from the city, Nicole Harper and Chris Maitland from City Council, Elon Sims from the Crane Group, Todd Diefendorfer from our Department of Neighborhoods, Michael Wilkos from United Way, and Emily Savers from the Columbus Foundation. All of us came together and said, how can we make this an RFP that is simple yet meets the things that we need to meet in order to get these funds out? So I am really thankful, and we're going to go through this presentation now. Michael can bring it up, and as you have questions, please put them into the Q&A. Michael's going to filter through those. We'll have about 5 minutes at the end of my presentation to answer some of those questions. Then Melanie Hill will present the application process itself. And then we'll have a Q&A at the end, and we'll go on for a few more minutes at the end, just to see if we can answer some of those questions. So here we go. City of Columbus, Franklin County Board of Commissioners. This is the Resilience Initiative. We are increasing our capacity for recovery. And so Mayor Ginther and the Board of Commissioners have joined together in this initiative. Okay, next slide. So the City of Columbus and Franklin County, we've announced this request for proposals. It's the Columbus and Franklin County Resilience Initiative. It's through the 2020 CARES Act. So as we go through this, you're going to see the flavor of the CARES Act come through this, because it's going to set boundaries on what this grant award can be like. As I've already mentioned, and Dayna already mentioned, we have $20 million. Dayna and I and all of us at the city and county, we want to see you spend this money. We do not want you to give it back to us, because we're going to just have to give it back to the US Treasury. So we want this money to be spent, but we have to spend it wisely. We have to spend it within the boundaries that have been given. But this is for Health and Human Services, serving residents of Columbus and Franklin County. So the application period opened on July 8th. So it's been open for 2 days, and there's already people in United Way's EC Impact working on applications. The deadline, and I'll say this several times, the deadline is 5 p.m. Monday, July 27th. So EC Impact will lock down at 5 o'clock. So at 4:49, you can put it in, but at 5 o'clock, things will be locked down. The request for proposals will cover a grant period going back to March 1st through November 30th. So you can look back as we talk about this, and you can look forward. But that's the period that the CARES Act and US Treasury has said we can use, and you can kind of see why. That's when the pandemic started. So as we look at the things that are eligible, you have to look starting March 1st. I mean, none of us on January 1st were thinking about this. None of us had these kinds of things in our budgets. So things changed in March. And so that's what we want to look at. What happens starting March 1st, and when you look forward through November 30th. Okay, next slide. So here's the link. It's in this webinar. You'll see it in the RFP, but that's the link to Central Ohio's EC Impact, and Melanie will talking about that later on, exactly how that's going to work. Okay, next slide. So here's our vision. Here's the reality. Here's the work. So our vision is that you as agencies and our residents are resilient. We feel that each of you have the ability to bounce back. This is an investment that we want to make in helping you do that. The reality, and I'm using words because, that you're going to see here because it's part of what's eligible. The COVID pandemic caused unforeseen needs among Columbus and Franklin County residents. In addition, you as human service agencies, as you were meeting those needs, were impacted by unforeseen, unbudgeted costs. Remember, I was saying how in January 1, your budget didn't have pandemic as a line item. So after March 1st, we had these unforeseen costs, unbudgeted costs, and all of us started experiencing, both residents, agencies, the city, the county, economic instability. And so we are thankful that the federal government, through the CARES Act and the US Treasury, has said, here's funds that you can use to invest back into your community to bring some stability. So this is our work. We want to increase the capacity of human service providers to recover as quickly as possible because we know that you're here in the work of meeting increasing demands of residents for goods and services. So as has been said, these funds are really about helping the helpers. Next slide. So as we look at these requests, as they start coming in over the next couple of weeks, as we start to review them after July 27th, the purpose and the values that we're going to bring to this are that it's for 501c3 organizations, it's for human services that are to residents in Columbus or Franklin County. Applications then will be reviewed. There's going to be thresholds that we're going to go over in a minute. There's eligibility of the organization and there's eligibility of the funding request. So this is not about designing new programs. This is about, or competition between programs. This is about just you tell us as an agency, here's what our needs are. Here's what you can do to help us fill the gap. So these are our values that we bring. We want to build on strategic investments in the human service system. You know, we know there's already investments out there. We want to build on those. We want to provide service equity to all patients, clients, customers, consumers, and service users. And we want to produce results that aid in the long-term recovery efforts. So those are the values that as we review these, and as we fund these, and as we go into grant agreements, you're going to see these values in the things that we're doing. Okay, next slide. So we are going to try to make this as simple as possible, but you know, those of you who know me, I've been with the city for 37 years as of this past June. I live and work and breathe in a bureaucracy. So there's going to be bureaucratic things here that we're all going to have to deal with, but we tried to, through a group of friends that I worked with, to make this as simple as possible. So applicant agency must be a 501c3 nonprofit. You must be providing health and/or human services. You are serving residents of Columbus and/or Franklin County. You're in good standing with the Internal Revenue Service, and you're in compliance with the State of Ohio Attorney General's Office. So that's what we're going to look at as an applicant. Next slide. So here's the funding guidelines. Because this is about the agency, not about a particular program necessarily, because a lot of you have 1 or 2 or 20 different programs. We're only looking for 1 application per 501c3. That's what will be accepted. So if you accidentally turn in 2, we're going to take the first one that came in. So only 1 application. However, there's no minimum or maximum grant award. The limit will be based on what you're eligible for. And as you walk through the application, you're going to see how that eligibility of fund requests happens. The City of Columbus and Franklin County, however, reserve the right to not award or to partially award eligible agencies and eligible fund requests. So let me give you one example of how that could happen is that we have $20 million and we get requests for $35 million. So at some point we're going to have to either not award, even if it's eligible, or partially award. So those are things that the reviewers and decision makers will eventually have to wrestle with. Fourth point, grant funding can be used for these two categories. So this is the main thing we're going to be talking about in the next couple slides. Revenue losses is category 1, and or increased expenses, which is category 2. So I said and or there because you could just do category 1 if you want, or you could just do category 2, or you could combine the two things and create, but again, it's only going to create one funding request. Again, it's for those things incurred from March 1 to November 30, 2020, as caused by or in response to the COVID-19 public health emergency. And I wanted to make sure I said that because you're going to see that several times. You'll see it even in your grant agreement. Once we award, we're going to say, you are agreeing to use these funds as caused by or in response to COVID-19. This is important. Grant funding may not supplant other federal funds. So this is something that U.S. Treasury CARES Act tells us. If you have used other federal funds for the things, for these losses or these expenses, we can't supplant those funds that have been received by the applicant agency. So you'll see that in the application as you go through it on the EC Impact. Agencies that are awarded grants will be required to submit final expenditure and activity reports of their agreements by December 4th. So your grant agreement would go through November 30th. Just a few days later, we need you to turn around an expenditure and activity report because the city and the county have to report back to the U.S. Treasury by the end of the year, by December 31st. So, and then if there's any unused funds, which Dayna and I are saying, please use all the funds. But if there's any unused or unexpended funds, we need those back from you on December 11th. And then the final bullet point there is CARES Act funds are federal U.S. Treasury funds. As such, they're subject to federal regulations, including but not limited to the Single Audit Act and the second CFR, and I'm not going to say all those numbers, but it's basically subrecipient monitoring. So the county and the city are recipients of these funds. When we do a grant agreement with any of you, you are now subrecipients, and so you're going to be subject to that monitoring. So I'd encourage you to read those CFRs. You pretty much, you can go online and just type those in and it should come up. Just to say, do I want to get into this red tape, this bureaucracy of federal regulations? That's just a choice that you're going to have to make, but we want to be upfront and say, this is something that you're going to have to work with. Okay, next slide. Here's the timeline, very simple. We're already in the application time. You can already get into EC Impact. Today we're doing the webinar. July 27th, 5 o'clock is the deadline. You'll see that in EC Impact, it's right there in front of you. One application per agency. By August 14th, we will make recommendations to an external grant review committee that will be set up by the city and the county. They will be looking at equitable distribution of these funds. And then once they've looked at that, then they'll give their okay to the mayor and to the county commissioners and to Columbus City Council. Then we will make conditional awards. And they're conditional because we have to wait till September for those to go to City Council and to the commissioners for a vote. So that's our timeline that we're going to really try to stick to. So then once those are awarded, then we will execute agreements. We're going to do our best, and I think Dayna will be doing this too, to have agreements as ready as possible so that when it's voted on, we can start the execution process. Okay, next slide. So this is important. These are check boxes that you're going to see in EC Impact. So you're going to check these boxes. So this is the threshold. So this is the threshold of the door to get in to the house. So you need to walk through this. So every one of these, you need to, in good conscience and in all honesty, say, yes, this agency is in good standing with Federal Internal Revenue Service. So we're not going to have you upload your 501c3. We're not having you upload a 990. We just want you to check this box and say, we're in good standing. We're in compliance with the State of Ohio Attorney General's office. So I'd encourage you to go onto that website, and there's a place where you can type in your name and it'll show whether you're in compliance or not. Basically, you have to annually give them a report so that you're in good standing with them. So be sure if you need to do that by July 27th to make sure that you're in compliance. You're to check all the proposed funding requests are for expenses and losses caused by or in response to the COVID-19 public health emergency. You're going to check all funding requests are for expenses and losses that occurred between March 1, 2020 and November 30, 2020. This funding request is not supplanting other federal funds. You need to check that box. You're going to agree to ensure non-duplication of efforts for budgeted items and that the funds are used appropriately. And this is something that's right out of the CARES Act guidance that we've received. This agency is aware that these U.S. Treasury CARES Act funds are federal funds, subject to all applicable federal regulations. You'll check that you're providing health or human services to Columbus and Franklin County residents. If you go outside the county for some of the things that you do, that's okay. What you're basically saying at this checkbox is, we're not 100% outside the county. We are doing work inside Columbus and Franklin County. And then the final checkbox is, you'll see this will be in the agreement itself that we have, that you're agreeing and will be agreeing to the following statement: that you will provide services without regard to race, religion, national origin, ethnicity, age, gender identity and expression, disability, sexual orientation, veteran status, familial status, or socioeconomic status, and agree to maintain a commitment to cultural competence and ongoing development of cultural competence capabilities of staff and organization. So please read that statement. Be sure that you as an agency are able to agree to that statement, both in the application and in the grant agreement once grant funds are awarded. Okay, next slide. Okay, so this is the crux of it. There are two categories. Those two categories are going to equal one proposal. First category is agency revenue loss. Second category is increased or new expenses, and there's two buckets within that. One is unforeseen and unbudgeted agency business expenses, and we'll go through what those are. Bucket B is unforeseen expenses for residents of Columbus and Franklin County who are trying to access basic needs, stabilization support, resource support. And remember, all this must be caused by or in response to the COVID-19 public health emergency from March 1 through November 30. Next slide. So here's a little breakdown. It's further broken down. You'll see more inside the RFP. So this category 1 is agency revenue loss. So these were unforeseen losses, again, caused by or in response to COVID-19 between the dates of March 1 and November 30. So by revenue, we mean income that was coming into the agency for operation and programming. In the RFP, there's an appendix. We're going to have it up here in just a second as some examples. Go ahead to the next slide. Before we do those examples, here's what you'll see in EC Impact, the application questions. So if you say, hey, I have revenue losses, you check that, then this will open up some questions for you to answer. What is the amount of revenue loss? Give us a concise description of that your agency revenue loss. And it's 500 words. We're doing that because we want you to be concise. We think you can do it in that amount. It's like 3,000 characters, I think, within EC Impact, so 500 words, so that because we are expecting lots of proposals and we want to be able to get through those proposals in an expedited way. So the less words we have to read, the better, just to be honest. We want to be 500 words for a description of that loss. You're going to check off, here's the other things that we've already used for that loss, and then there's going to be subtracting from that first number 1. You're going to subtract those, and that you'll see a grant calculator in there that Melanie has set up. So federal funds, City Columbus funds, Franklin County funds, other COVID emergency response funds, like from Columbus Foundation or United Way. So we're not saying your things you'd already had in your budget, revenues that were already there, but those things, if you had to use those for COVID, those are things you could then use also as a possible revenue loss, because you had to take that money you'd already had budgeted and to use it for something that was unforeseen. Hopefully that makes sense. If it doesn't, you can ask a question. So you're going to explain how the revenue loss was caused by or in response to COVID-19, and then there'll be an amount of a request. So then that amount of request will be added to category 2. And then the last thing is 250 words or less, just how is this going to benefit the residents of Columbus and Franklin County? Okay, so that's category 1, and then some examples of revenue losses could be fundraising losses, you had fees for services that you lost, individual donations that were lost because of COVID-19, reimbursements that you were expecting that you didn't get. Maybe there was a social enterprise or retail losses that because of COVID-19, you were not able to have income because of that. And then what else? There may be other things that we haven't thought of. So this is not an exhaustive list. It's just to give you ideas of revenue losses. Okay, and then category 2 is increased or new expenses. So this is different. So the losses is income. Increased or new expenses are costs. So business expenses, access to basic stabilization and resource expenses for residents that you're paying out. So again, caused by or in response to COVID-19, March 1 through November 30. The expense means the cost required to buy or obtain goods or services. So back to my other illustration, maybe you had something budgeted already, but you have this increased expense and that wasn't in your budget. So you can use that as something for us to fill that gap. There'll be an Appendix B and Appendix C in the RFP, and we'll have those up in just a second. So go ahead to the next slide. So same kind of questions for these 2 buckets. Bucket A, you'll have this question. Bucket B, you'll have these questions. Again, what's the amount? Give us a description. What are the other sources you've already used to meet the needs? Explain how it was caused by or in response to COVID-19. Amount of the city funding request. So what's the actual amount after you subtract those other things? And then how is this going to benefit the residents of Columbus? Next slide. So this is pretty big. So these business expenses can be for operational, administrative, technological, and okay, I'm hiding, I'm being hidden, I can't see. Okay, technological, staffing, supply expenses required to support the applicant agency. So again, as caused by and in response to COVID-19. We have some examples in the following slide, but the grants can also be used for capital expenditures, not for new construction, but they could be used for renovation, remodeling, building repairs, architectural engineering plans, if you can document it was caused by or in response to COVID-19, expended during the time frame of the grant period from March 1 to November 30. So not what you're planning to expend next year, but what you actually expended. So if you are a childcare agency and you're a 501c3 and you had to remodel because of COVID, because the state required new things, that would be an example that of a capital expenditure that you, if you are expending it now or in the next few weeks or in the past few months, that would be an eligible expenditure. So examples on the following slide. So I'm not going to read through all these. These are also in the RFP, but like cleaning services, I'm sure a lot of you had that. If they weren't funded through some other way, you could, you know, from another federal source or another city or county source, you can use those. Data management infrastructure, technology, hardware or software, staffing expenses like hazard pay, hiring to fill a volunteer loss, costs for volunteers, wellness initiatives, things that are all associated with COVID-19, but were not filled by another federal or another COVID-19 related funding source. Okay, next slide. And so then basic needs. So if you have residents that had needs and you had things that you were providing that you were not expecting, and those were not covered by some other funding source that was a COVID-19 funding source, these include the following that you see in front of you, and then what else? So again, not an exhaustive list, but those give you some good ideas. Then the next page, child care, education training, transportation, workforce development, all those things would qualify as increased expenses. And what else? So you tell us, here's the expense, didn't get covered from any other COVID-19 or federal dollars. That's a gap that we have that we can fill. Okay, next slide. Okay, I've reached the end. These are our contacts. By Monday or Tuesday next week, we'll have FAQs up on the city's website, the county website, and with United Way at EC Impact. Mike's going to collect these questions today. We'll use those as a beginning point to kind of get that started. Technical assistance, please use this. For me, use this human service programs at columbus.gov. Although many of you have my columbus.gov email, I want to try to keep that free from this as much as possible so that we can make sure we get focused and we have intention about getting to those questions that are coming specifically about the resilience initiative. So use that human service programs at columbus.gov. Melanie will go over this, but that's going to be your technical assistance for EC Impact. And then this is me. I gave myself this new title for about 2 months, the Resilience Initiative Coordinator. So with a whole bunch of friends, we're trying to really bring this together to help you over these next few months. Go ahead, next slide. So questions. So if you want to, Michael's going to try to filter some questions out. He'll come on and give me a couple questions. We'll do that for like 5 minutes, and then we'll turn it over to Melanie.
All right. First, thank you so much, Kim, for this really thoughtful walkthrough. We've received 24 questions that I feel like you should answer rather than me. We obviously won't get through all of those. The most frequent question that we've received thus far is how PPP dollars might be taken into consideration or affect an agency's application.
So that would be a case where when you go through and it says what federal funds have you already received for any revenue loss that you've had, if those PPP dollars were used for a revenue loss or for a business expense that was an increased business expense or unforeseen, then those would be subtracted out. So it's whatever losses remain after those are subtracted out.
Okay, thank you. Another question that had a few different iterations was regarding a 501c3's status. If a status is still pending for a 501c3, can they be eligible, or are they eligible for these dollars?
That's a really good question. I mean, my first response is going to be, I don't think so. But let me take that question and talk with a couple people about it and then get back to you. So go ahead and submit that question to the Human Service Programs line 2 so I don't make sure I don't miss it. But we'll also put that on the FAQ once we have an answer.
Okay. We have a question on who will be sitting on the review panel.
Okay, so that external grant review panel is still being put together by the mayor's office and my director, Mike Stevens, and the county. So once that's together, I'm hoping that's next week, because they aren't going to see this for another couple of weeks, but hopefully by next week, we'll have names for people and that'll be announced.
Okay. One question that I think will be of interest to many: if we wish to apply for revenue loss from fundraising events and individual donations, how far back should we look to set a benchmark as compared to last year's fundraising, 3 years average, or what?
We don't really have a guideline that says how to convince us that that's what it is. So I would put forth your best. If you think an average is what's going to best show us that this is what it would have looked like this year. But if you just did it last year for the first time, or unless you did it for the last 20 years, I mean, we really don't have a guideline. So you really make that argument as to here's how we got to that number.
Okay.
Let me just add something real
Please.
quick. So it wouldn't be, well, this is the first time we tried something. We were going to do a bake sale, you know, in the end of March, and we just weren't able to do it. It was the first one we ever did. That one we wouldn't be able, we wouldn't be able to use that. But yes, definitely if you had something last year or in years past, that would be the way to do it.
Let's do one more question and then we will move on to Melanie. For all of those of you that have asked questions that haven't been answered, rest assured I'm documenting all of these and we'll be sharing these with Kim and with Dayna. So thank you for submitting your questions. The last question that a few folks asked is relation to subscription services that have been incurred. If they're, are they eligible in the time period? What if they also run beyond the March to November 30 time period?
So I guess I would, if you can make an argument that this was an expense that you, first of all, was not in your budget for the year, so it was something new, then yes, if you can show, because what we're going to have to show the U.S. Treasury is that this money got spent. So if you are spending money for a subscription that maybe goes beyond November 30, but for the next few months, you have that expense and you can document that you paid that, even if it just was through November 30th, then we could do that through November 30th. If you paid for that subscription for a whole year, but you paid for it now, then yeah, as long as that expense happened during this time period, I think we're good.
Okay, Kim, thank you so much. Really appreciate your thoughtfulness and leadership on this. If I could ask Melanie to, okay, great. And then I'll pull up your presentation, Melanie, while you do some introductory remarks.
Okay, good morning, everybody. I'm excited to be here representing United Way, and we're really excited to partner with the City of Columbus and with the county to help distribute these dollars into the community. So today, I'm just going to walk us through the very technical process of registering with the EC Impact portal. Many agencies are already familiar with the platform. If you receive funding from United Way, if you receive human services grant funding, I think community partnership dollars through Franklin County Board of Commissioners, then you're already familiar with EC Impact, and this will be really simple. So just a couple of notes or comment about this. The only way that applications are being received is through the EC Impact online portal. So you can't download the PDF and fill it out and email it to Kim or email it anywhere. You have to do it through EC Impact. And I recommend and encourage people to review the RFP and don't bother signing on to EC Impact if you're not going to fill out the application. So Kim has definitely given us a good overview of what the questions are and what would make you eligible or ineligible. So just take that into consideration. If your agency is not already registered with EC Impact, you will have to create an account. And that's what this second point here is talking about. There's the link. The link to it is here. It's also on Kim's, on his presentation. It's the same place. And the most important thing to know is you have to have your EIN number, employee identification number, to register an agency. You cannot get past the front screen unless you have the EIN number. And so that's going to be the first step. And if for some reason, if you put in an EIN and it says, it's not valid or we don't recognize it, and you can't move any further, at that point, you're going to want to email us at reporting.help, and we will be able to help you. We can, assuming that there's some kind of an issue and you're eligible to apply, then we will manually register your agency and then grant you access, and you'll be able to log in once we've set up your account. And an example of someone who might not be able to register using their EIN would be if it's a new agency. So there's an organization called GuideStar where they kind of track nonprofit organizations. And this system, our EC Impact system, it kind of validates agencies, and it collects some basic information through GuideStar, which is why you have to put in your EIN number. So when you enter the EIN, on the back end of this, EC Impact is going to talk to GuideStar. It's going to pre-populate the name of your organization, your EIN number, and a couple of other basic data points. And then it's going to, generate your account and give you access, and you're going to fill in a bunch of additional details. If you're a newer organization, that whole process of getting into the GuideStar system might not have happened yet. And so that would be an example of a reason why you're not able to register. It also might be the case that somebody else at your organization already registered your agency, and maybe you don't know about it or you don't use the system. If you get something like that, then you're going to want to talk to somebody else at your agency and get a login, or you could also email the reporting.help and we can set you up with a login and get you access. If an agency is already using EC Impact, all you have to do is log in, and a little bit further in the presentation we'll tell you where to find this new application. Next slide. So this is a screenshot, and I'm going through a bunch of screenshots, so I'm going to move quickly, but you'll obviously be able to refer back to this. So the left side of the screen shows the main page, and at the top of it is where you sign in if you're already registered. And then at the bottom it says new to EC Impact, and you click that green button, and then it's going to pop up this window where you enter your EIN number, and then you click the next button. Next slide. So this is going to be for new agencies. You're just going to fill out some agency registration information. Some of the fields are required. If you try to move forward and you haven't filled out a required field, it's going to be red and show you have to fill this out. And then you're also going to establish a login and a password. Our recommendation is that you use your email address as your login, because it's going to be a unique login, because people do not have the same email addresses. Whereas if you come up with a login name of mhill1, it might already be taken. So a safe bet is to use your email address. It's also easy to remember, but you have the choice to set it as whatever you want. And then you're going to click next at the bottom of the page. Next slide. And then, oh, this is an aside. So for an agency with an existing account, you're going to log in, and on the left side of the screen, it says apply report. And right underneath the words apply report, it says grant applications. That is a clickable link. You could zoom in on that, Michael, and maybe it'll be a little bit more visible. Yes, see under apply report, it says grant applications. You would click on that if you already have an EC Impact account. And that's how you're going to get to the next. So next slide. What'll happen if you, once you register your agency and hit next, or if you're already on and you click that grant application, you're going to see a page with choices. This is probably going to be it's depending on if you're already using the system or not. This will be the first choice, or you might have to scroll past other options. You're going to just click the button there to select it and go down to the bottom of the page and hit the green next button. And that is how you opt into this grant process. Next slide. It's gonna, for new agencies, it's gonna, at that point, it's gonna tell you to review your registration information and click the complete registration button at the bottom of the page. It'll be at the bottom right-hand side. So you'll just click complete registration, and then next slide. That's gonna give you a confirmation. So the green bar is like a symbol of success and completion in EC Impact. It's gonna send a confirmation email to you as well. But you'll get a visual kind of confirmation. And then you're gonna go down to the bottom of the page and click next. Next slide. So this takes you to the main page of the RFP. And at the top of it, you can see all of the information that Kim has already gone over. It's kind of the vision and general guidelines, kind of instructional information. You're gonna wanna scroll down the page. And if you go to the next slide, because it was kind of long, it doesn't all fit on one screenshot for me. But at the bottom of that page, where all this red and blue is, this is where the actual forms are for you to answer the specific questions. There's 2 forms or sections, if you will, and you're going to click on each one and begin to answer your questions. It's going to save automatically if you, as you hit the enter button and as you hit the tab button. And then you also are going to have the option to click save my work and then save my work and mark it as completed. So go to the next slide. And the color is different. Instead of red, it's this gold color, and it says in progress. And so your whole application, meaning the both forms combined, the status of it is in progress. And then, Michael, if you can zoom in a little bit, I think it'll be easier for people to see. So each form itself, you know, they both have their own status as well. So this the first form says Columbus and Franklin County Resilience Initiative application. That's the main application. On this example, it's completed and ready to submit. That means that the user is done and says that it's ready to submit, but it's still at this point, you can go back and make changes. The bottom form is still red, so it is not started. So you would have to click in there and finish, you know, answer all the questions and mark it as completed in order to move to the next stage. So I think the whole progress, the status bar, it makes it easy for us to see where you're at in the process, if you have submitted it or if it's still in progress. And this is really important. If we go to the next slide. And you can zoom in on this. This is an example of an application that is not submitted and it will not get reviewed if they don't take the next step and hit the submit button. It says completed and ready to submit and it's beige, but that's not gonna, it's not finished. So you have to make both forms, get both forms into the completed and ready to submit status. And only after that happens will you get this option with this red button to submit the application. And it's going to default with, I think, the primary contact of your agency's email address in here, but you do have the option to change it if you need that confirmation email to go to somebody else. So then you're going to hit that submit button. It's going to send a confirmation email to whoever you said. And then if we go to the next slide, I'm going to show you what the submitted status looks like. It's green. Everything is green, and you're going to see that confirmation message at the top. It's going to say, thank you for submitting your application. You know, you'll get notified on August 31st. The status bar is green, and it confirms that you have submitted everything. Once you go into submitted status, you can't make any more changes to your application, but you can go back and look at it. It's read-only. You can print it off. You just can't make any changes to it. And we need it to be in submitted form because we don't want there to be any question, you know, that it's complete. If for some reason you hit the submit button and you find an error or something, you would have to email us at reporting.help to go on the back end and allow for you to make a change or a revision. So it's not the end of the world if you submit it and you find a mistake. You just have to reach out to us, and that does need to happen before the deadline, because after the deadline, it's all shut down. So I think you can go to the next slide. I think that's the end. Yeah, if you have questions specific to the application, like content related, like, you know, can I include this dollar amount? A lot of the questions that I've seen come up already, those questions should be directed to the Human Service Programs email, because at United Way, we're kind of technical support, and we can deal with if EC Impact is not working, if you can't log in, you know, some technical aspect, we can help you with that and with getting it submitted and whatnot. And then content related questions, you're gonna wanna direct those toward Kim and Dayna for them to give their insight. So that's it for my part of the presentation as well. And I think we're opening for questions.
Yes, thank you so much, Melanie. That was really helpful. You have two specific questions that have come in. The first is, if an agency is registered with EC Impact through United Way in another county, do they need to create a new account for Franklin County or for Central Ohio?
Yes, our systems do not talk across counties.
Great. And then the second question was, are we able to have multiple users accessing the same application? In other words, multiple users per agency?
Yes, you can do that. Without going into the details, you can add users to the profile. I think it's a pretty user-friendly system. If you have trouble adding users, reach out to us, send an email to the reporting.help, and we'll show you how to do it yourself. You can do it yourself as an agency, and we can do it on our end as well. So I would recommend that you try so we don't get too flooded. But if you're not able to do it on your own, just send us an email and we will walk you through that or get it taken care of for you. And I'll also add this on there. If you're an agency that, like for instance, if it's a newer 501c3 that for some reason it's not, your information is not registering on GuideStar and you're not able to register, email us at thereporting.help. Include your agency name, your EIN number, and as well as a name who's going to be the primary contact at your organization and that person's email address. Because we will need that basic information to be able to follow up with you and share what your agency user login is going to be.
Terrific. Melanie, those are all of the questions that we received for you. So thank you so much for that. We have 265 people still participating on the call. Kim, I believe you're able to answer some more questions if you have some time. Obviously, we're at 11:03 and we said we were going just to 11.
Sure. Yeah, before we jump into that, and yeah, we can spend some more time as people want to. I just want to make sure I say thanks to Melanie. 3 weeks ago, we were told, okay, we need to come up with a process for an RFP, and Melanie's went, what? And so she and her data science team have like really put this together quickly. And I know Dayna and I just love working with Melanie and with her team. And so I just want to thank her and United Way. This is just great. And I think if you've never used DC Impact, I think you'll have a great user experience. And I know we do as reviewers. So thanks, Melanie.
Thank you. You guys are great partners, both you and Dayna.
Yeah. And so Mike, could you go back to my presentation and go back to the very last slide?
Yes.
And while we're doing that, we can start answering questions.
Yes. 1 second here.
Just because I don't want people to really see me.
I can still see you, Kim.
I know.
There we go. Okay.
So the next slide. Okay, so these are my final words. So we'll just keep that up there while we're answering questions.
That sounds good. First, I'll also say, as people might be hopping off the call, thank you to each of you. Thank you to your colleagues at the city, the county, and United Way for all of your work with us, and certainly your thoughtfulness in supporting the sector. We know these are just massive challenges, and it's imperative that we have a city and a county that are doing all they can with these federal dollars to support the sector and the community and the people that everyone is serving. And let me also thank all of the people participating on this call. I get to work with about 90 agencies every day through my role, and I'm in awe every day, especially the last 4 months, of the Herculean work that you're doing and having to navigate it given all these extraordinary challenges. So thank you to everyone for the work you're continuing to do. With that, let's get into some questions. And Kim, thanks again for your willingness to stick around a little later and answer some of these in real time. One question that has come through in a couple different forms, if I can find it now, I lost it because a number of new questions came in. Here we go. How do you recommend organizations who host multiple programs divide out the various programs' funding requests within the single application funding request which is required.
So I mean, we're not, so I don't know, maybe I'll need help understanding the question. So it's, and Michael, maybe you can help me figure this out. So because the way I'm looking at it, and so it's good to get your feedback, your guys' feedback, is that you're going to take all those different expenses and say, look, here's all the new expenses that we had as an agency, or we're predicting to have before November 30th, and just add them all together. So in that 500 words that you're going to have for business expense or for basic needs, those two buckets, you're just going to say, look, we had 4 different programs. All of these had increased expenses, and we're adding those all together for our funding request. Michael, I'm going to look at you. Am I making sense of the question, or am I missing?
No, I think that's right. I think the question that I'm seeing in various forms is, okay, we have these 2 buckets, we have new costs and we have new expenses across various areas. How do we present that
Right.
in the grant application?
So I think there's choices. I mean, you could take just one of your programs and just say, this is the one we really want to fill the gap on. Or you could say, look, as a whole agency, we've been impacted. All of our programs have been impacted. So we're going to get our CFO to come up with one request that then we're going to take out as an agency and divide among those programs. So that the city's not looking at all your different programs. We're looking at you and the county. We're looking at you as an agency, how you have been impacted as an agency.
Okay. Another relatively common question, is there any guidance on what would constitute documentation for revenue loss?
So initially we're just asking you to describe it. So we're not asking for that for actual documentation, but I think once we have a grant agreement and we look back to you and say, okay, now this is what you said, we'll have to come up with some documentation ideas, I think, between city and county, but it could be as easy as, here's something on our letterhead that said in 2019 we had a fundraiser, and we can show you here's what came in, and that might be documentation. So I think we'll wrestle with that when we get into the grant agreement stage.
Great. Let's see.
And while you're thinking, Dayna, if you have things you want to throw in, please do that too.
Thanks, Kim. I think you described that perfectly. And I think we're so used to seeing and reflecting about our agencies in terms of programs. But for this initiative, it's important to remember that we're rolling all of those expenses up, and we're talking about your agency, not about individual programs.
Okay, new question, also asked in a couple of different ways. What is considered hazard pay?
I guess I would go to whatever definition that we've been using through this pandemic. So I don't have a definition. I think that goes back to the agency to tell us, here's where we had to put some of our staff into harm's way. We chose to give them additional funds, or in some way just not a bonus per se, but we're increasing your salary this much. That was not foreseen in the budget in January, but because you're in harm's way for whatever reason, that was hazard pay. So it's an expense that you have been doing or will do, through November 30th.
Okay. One kind of administrative question that came in that I think will be helpful for everyone to hear. You've obviously got that email address set up to receive questions. Is there a deadline at which questions will no longer be able to be submitted and answered?
Well, questions specific about the application would be, since it's due at 5 on July 27th, I think we can take questions up to 4:58 on July 27th. I mean, I'll try to watch, Monday will be the day that I'll just really watch that and make sure the questions are being answered.
Kim, I just wanted to jump in and say that I think in order to reduce confusion and really help people to get answers to their questions as quickly as possible, I want to encourage people to use that email address that you called out, and the county will have a link to your FAQs. We're not going to duplicate the list. I don't want there to be any lag time, or I don't want your website to say one thing and ours says something different. So we will have a direct link to point people over to you.
Good.
Thank you for that, Dayna. We'll do a few more questions, and then the rest we'll gather and collect, and I'll share with everyone, and of course with the panelists for the Q&A that will be pulled together. One question here: are you looking for specific ways to promote long-term recovery?
No, I mean, I'm not specific. We're really looking at you as an agency to tell us, here's what we're seeing on the ground, and here are ways that we can see if we make an investment, either you're already doing it or something we see that we could continue doing to bring us into recovery. You tell us.
Okay. Are organizations that provide support to human service agencies eligible?
I don't, Michael, do you have an example of what that would be?
I think what the questioner is asking is, do the services that are being provided, the human services being provided, have to be direct? Or if it's an agency that is doing work that is more indirectly a human service provider, are they also eligible for these funds?
Right, so one, are they a 501c3? Two, are they serving residents in Columbus and Franklin County? Three, are they doing health and human service? So yeah, I mean, so direct and indirect, we would, as long as they're, as we were talking, Mike and I were talking yesterday about what is human services, and then part of that is direct service, part of that is indirect service, helping vulnerable populations. So if you can make that case, then yeah.
Great, thank you, Kim. A few questions about whether the city and the county will be advocating to Congress to extend the spendability timeline of the CARES dollars past November 30th, 2020.
Yeah, I'm sure there is some advocacy going on. I think Dayna's going to do all the advocacy.
I'm over here laughing. I'm thinking about, I'm not in control of that, but I certainly, I feel you. It's such a short window.
Yeah. Yeah, I mean, we've had to deal with short windows on funding before, but this is like the shortest. I mean, remember, there was 157 million to the city, and I think 70 some million to the county. And all of that has to be spent by the end of the year, or we have to give it back. So I think there are some people who are trying to make that happen, but we're like moving forward as if it's not going to happen.
Thank you, Kim, and thank you, Dayna. I will add, putting on my Human Service Chamber hat, we are actively requesting to each of our congressional delegation members in the U.S. House and the U.S. Senate to extend that timeline for when these CARES dollars can be spent, while we're concurrently advocating for more dollars to be distributed to health and human services agencies in the next CARES Act that we believe will be forthcoming sometime now, seeming to be in August as opposed to July. So yes, there are efforts that are ongoing for whatever that's worth. We'll do a few more questions, then we'll let everyone go. Will equity considerations be given to typically underfunded Black organizations?
Well, I'm not sure what is meant by equity consideration. So that's you saw the values that we held, and that we also are going to have this external review committee looking at equitable distribution. And so I'm going to look to that committee to help us determine what's equitable distribution. We're really kind of looking at this as all of us, every agency coming in that's eligible is going to be eligible for funding.
Two more questions. Is there any elaboration in the Treasury support or Treasury documents or Treasury guidance rather around what constitutes, quote, caused by or in response to COVID-19?
That's a really good question, and I don't know. I'm just going to say I don't know. I have a feeling that this is it. This big question is it, or this vague statement. But if we find something, we'll put it out there. Again, I'm going to look at the agency to tell me, hey, this is because of COVID-19, or we're responding because of COVID-19 in this way.
I will go ahead and editorialize a little bit. I think it's probably to our benefit that there isn't any specific language beyond what the Treasury Department has provided, because that gives the city and the county a little bit more latitude and gives the agencies more latitude to make the case. The narrower the Treasury Department might define that, the harder it might be to make the case broadly. Last question. For the increased expenses for stabilization efforts, does that only apply if it is our business to supply those items such as a food pantry, furniture bank, rental assistance, etc.? Or can we include an amount for those if our clients are expressing need for this and we do not have the funds to assist them?
I would include the latter, so that you have clients that you are serving who have a need, and if you can say, yeah, this is because of caused by or in response to COVID-19, but we don't have the funds to do that, but would if we did, then that, to me, that's a case for increased expenses or new expenses that are helping stabilize or bring support, resource support to your clients.
All right. First, let me thank all of you again for participating, and thank you to the 168 participants still with us for giving us an extra 20 minutes to answer questions. Thank you to Kim and to Dayna and Melanie for sticking around for that extra time as well. Thank you for all of your work in preparing for and even in making it possible to have this presentation to all of these nonprofit folks. Dayna, Kim, Melanie, any parting words before I wrap us up?
No, other than to thank you for making it all possible, because I have no technological wizardry that I could have done this, and you did it very well. Thank you.
Thank you, Michael.
Yes, we're grateful for your assistance.
My pleasure. Well, Kim, Dana, Melanie, thank you for everything. Thank you to all of you again for the work that you're doing on the ground, serving our community during this very tumultuous time. It's imperative, and I'm grateful that we can have a part in trying to make this process of applying for these CARES dollars as streamlined as possible. I will get a recording of this out later today, along with copies of the 2 presentations that were shared. I'll include links to all of the links that were provided within the presentations. Regarding the Q&A, I'm going to be passing everything along to Kim and to Dana and to Melanie, any other questions that we didn't get answered, and of course, all the ones that were. And I know that the materials they're putting together will be available and helpful going forward as well. Thank you all again. Thank you for your time. Thank you for your leadership, and have as good of a day and weekend as is possible. Thanks, everybody.
All right. Thank
Thank
you.
you. Bye.